head, biting or scratching. And stereotypical behaviors such as body rocking are also common, and there may be some connection between stereotypy and self-injury. Here's a Collins reference again. Now we're looking at self-injurious behaviors, and we can see that self-biting occurred in about 47%, head-to-body banging 55%, and the lowest rates were air swallowing, which is kind of an unusual self-injurious behavior. But most of these are running in about the 20% to the 40 to 50% range. So given that there might be a connection between stereotypical behaviors and self-injury in the Crete-Shot population, and also we know that stereotypies can respond to dopaminergic blockade, we might want to think about using an atypical antipsychotic, again starting with low-dose risperidone. Smith-Magenis syndrome has a very high rate of self-injurious behavior. Some people say essentially all patients with SMS will hurt themselves, and this also increases with age. Hand biting is the most common form, with other common things such as slapping the head, head banging, and picking of the skin and toe and fingernails to the point of bleeding. And another unusual feature of self-injury in this population is they will take foreign objects and stick them into various different body orifices. So severe injury could possibly happen, for example, puncturing the bowel. Finucane looked at this percentage prevalence in self-injury in the Smith-Magenis group by age group, both younger and older. And the next slide will show you that the rates are almost universally higher in the older age group. In the older age group, mean age about 25, younger age group mean about 6.5. But yet even in the younger age group, the percentages are still fairly significant. So for example, hand biting, they found was almost 87%. And the lowest rates were the insertion of something into the rectum, insertion in general. And the pulling of the picking of the fingernails and toenails was about 20% each, and the other ones are in about the 30 to 40% range. So again, the treatment, there's features of compulsivity, there's features of stereotypy, and there's features of self-stimulation. So in that order, if we were going to use medications, we might want to think of an SSRI for the compulsive features, atypical antipsychotic for the stereotypical features, and possibly naltrexone for the self-stimulatory or self-soothing type features of the self-injury. Next syndrome was Cornelia de Lange. A lot of variable reports on self-injury. The numbers vary widely, but the behaviors are typically of hitting, banging, biting, and a kind of a unique feature, what they call pulling at oneself or tightly hugging themselves, sometimes stuffing themselves into a corner or behind an object. Environmental changes are somewhat linked to the amount of self-injury that the patients engage in. So again, the behavioral evaluation looking at environmental features that might be either precipitating or exacerbating the self-injury. Basile looked at this, looking at the prevalence rates of behaviors in Cornelia de Lange, and compared it to other studies that had been done previously. And what Basile found was self-injurious behaviors were on the lower end compared to the other studies, which were in the 55 to low 60s percentage. Basile found 36%. Still fairly high, a full third plus. So treatment in Cornelia de Lange, as far as the self-injury, the self-restraint that they show is correlated in some way with compulsivity. So if medication is to be used, we want to use the SSRIs. The next syndrome related to self-injury is a very striking, very profound, and very scary level of self-injury, and that's with Lesch-Nyhan syndrome. This is the hallmark, self-injury. It's seen in almost all the people with this syndrome, although the majority will usually display it by the early age of 3 years. And the biting of the fingers and hands, the biting of the lips and cheeks can be quite severe, with associated medical complications. There's a lot in even the dental literature about using various devices to try to keep the biting from occurring. And you can see here in this next slide by Roby that either past or current rates of self-injury are really quite high in Lesch-Nyhan, to the point where the biting of the lips and mouths, both past and current, is almost 50%, and the same for biting the fingers, with the lowest rates of extreme rubbing, and that combined is about 11%. So the biting is a huge problem, can lead to really severe medical and even surgical complications, and there is a great need for interventions to try to prevent this. Naltrexone use in this population has shown mixed results to reduce self-injurious behavior, although the majority showed some decrease in the amount of self-injury. So given the unusual severity of this, we really want to think about a trial of naltrexone, especially if other things have failed. Other treatments have been tried, pretty much like in a lot of the things we talk about in this population, and that's risperidone, carbamazepine, the SSRIs, gabapentin, injections of botulinum toxin to paralyze certain muscle groups to, if not eliminate, at least reduce the force of the bite. And interestingly, the S-adenosylmethionine, popularly known as SAMe, which is used for various different things, has also been tried. So in concluding about both aggression and self-injury in the DD population in general and some of the specific syndromes that I talked about, risperidone has shown some pretty clear positive effects to reduce the behavioral disturbances in autistic disorder. The use of other agents for aggression and self-injury is still mostly guesswork. There's some small studies, not a lot of really good studies, certainly lacking in RCTs. So our future as far as the research field goes is to do more studies, good quality studies, randomized control trials, large N's, carrying these out beyond a few days or weeks to see what, if anything, will be helpful to reduce these very disturbing, potentially very dangerous behaviors in this population. So I thank you for your attention, and I hope that you enjoy the other talks in this series.